Good afternoon, Victor Brian. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET-speaking roleplay.
I completely understand how worrying it must be to see Emily unwell, especially when she has been running a high fever for 2 days. As a parent, it's natural to feel anxious about her condition. Mihiraa, I want to assure you that you're in the right place, and I'm here to help guide you through this. Now, let's go over what's happening with Emily. Based on my examination just now, it does seem like Emily has a viral infection, which is likely the cause of her high fever. A fever is indeed a common symptom with viral infections, and in most cases, especially in children like Emily who are generally healthy, it's usually not a cause for immediate alarm. However, it's really important we monitor it properly and make sure she's comfortable. So, for the next steps, I would like you to closely monitor her temperature at home, maybe every few hours, and especially if you notice any changes in her condition. It's also absolutely crucial to ensure she stays well hydrated. Encourage her to drink fluids regularly. Water, juice, or even ice pops can help. Are there any specific questions or concerns you have at this point?
Well, you mentioned a viral infection. How can you be sure it's just a virus and not something more serious like a bacterial infection? And why is she so irritable and not eating? It breaks my heart to see her so weak and refusing food.
Those are very important questions, Mihiraa, and it's good you're asking them. It's natural to want to understand why I think it's a viral infection and to be worried about Emily's irritability and lack of appetite. Let me explain my clinical opinion in a bit more detail to reassure you. So, first of all, remember that a fever itself is actually the body's clever way of fighting off infections, including viruses. It's like the body turning up the heat to make it less comfortable for the virus to thrive. In Emily's case, during my examination, I didn't find any signs that strongly suggest a bacterial infection. For example, she isn't complaining of ear pain, which can be a sign of ear infection, and thankfully, she's breathing comfortably without any difficulty. These are often red flags for bacterial infections in young children. Now, about her irritability and lack of appetite, yes, it is very common when children have a fever. When they are unwell and their bodies are working hard to fight off the infection, they often become more tired, fussy, and lose their desire to eat. It's just their body focusing on healing. As the infection starts to resolve and her fever comes down, you should see her energy levels improve and her appetite gradually return. For now, to help her feel more comfortable and bring down the fever, I would recommend giving her paracetamol, or acetaminophen, as directed. It's important to follow the correct dosage based on her weight, which I will confirm for you. Does this explanation help ease your mind a bit, and do you have any further questions about why I think it's viral, or about the paracetamol?
Yes, that does help, thank you. Paracetamol. I have some at home. But how often should I give it to her and for how long? Besides the fever, she has been coughing a bit and complaining about her throat being scratchy. Does that fit with a viral infection? And how long will this fever last usually?
Those are important questions about the treatment and her symptoms. Let's talk about Emily's symptoms first, as you mentioned the cough and sore throat. Mihiraa, could you walk me through everything you've noticed about her being unwell?
The fever, as I said, started 2 days ago, and it's been up and down. It tends to get higher in the evenings. The cough started about the same time as the fever, maybe slightly after. It's mostly dry, not much coming up. And she just says her throat is scratchy when I ask her.
Thank you for those details, Mihiraa, that's really helpful. And let's talk about the treatments you've tried so far. Knowing what you've already tried will help us decide on the best plan moving forward.
I gave her ibuprofen twice yesterday, the children's liquid form, about 5 milliliters each time, roughly 6 hours apart. I also tried putting a cool compress on her forehead, but she didn't really like that and kept pushing it away. That's about it, really. I wasn't sure what else to do other than giving her fever medicine.
Okay, thank you for sharing that. Giving her ibuprofen was reasonable, and the dose sounds appropriate. It's common for parents to use both paracetamol and ibuprofen for fevers, and that's sometimes advised, but it's important to know when and how to use them safely. Let's talk now about some strategies for managing Emily's fever at home, and then we can discuss when it's important to seek further medical help. I want to describe some common and effective strategies for managing fever at home. I'll suggest things like keeping her hydrated, dressing her in light clothing, and using lukewarm sponging if necessary. Finally, I want to advise you about when you should seek further medical attention, for example, if the fever persists beyond 3 days, or if she becomes very lethargic or develops any new concerning symptoms. Firstly, hydration is key, as we discussed. Keep encouraging her to drink fluids regularly. Don't worry too much if she's not eating much solid food right now, fluids are more important. Dress her in light, comfortable clothing, avoid overdressing her even if she feels a bit cold to touch sometimes, that can actually trap heat. If her fever remains high and she feels very uncomfortable, you can try lukewarm sponging, using a damp cloth with lukewarm water to gently sponge her skin, especially her forehead, armpits and groin. Avoid cold water or ice as that can make her shiver and actually increase her internal temperature. Regarding when to seek further medical attention, it's important to watch out for a few things. If her fever persists for more than 3 days, or if it goes very high and isn't responding to fever medicine, you should bring her back to see a doctor. Also, if you notice any new symptoms developing, like difficulty breathing, excessive drowsiness or lethargy, meaning she's unusually sleepy and hard to wake up, or if she develops a rash, or starts vomiting repeatedly, these would be reasons to seek medical help sooner rather than later. Does that make sense, Mihiraa?
Yes, that's all very clear. Thank you so much. I will definitely follow as you suggested. Thank you, Victor.
You're very welcome, Mihiraa. Remember, we're here to support you. Don't hesitate to contact us again if you have any further worries. I hope Emily feels better soon. Take care.